This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. I have actually a return guest today. You've heard him before. It's Dr. Tracy Gapin. He is with the Gapin Institute. He is a board-certified urologist, leading men's health and performance expert. And so we are just going to talk once again all about men's health today and just kind of what he does and how men can just optimize their health. So Dr. Gapin, welcome back on the show.
Hey, thanks so much, Greg. Glad to be with you again.
Yeah, so I may have asked this the first time, but it's always interesting to me to hear people's story about, especially specialists that kind of transition over, from just that conventional specialty into more precision medicine or integrative medicine, whatever you want to call it. I mean, basically wanting to optimize health, with which we both know, quote, conventional medicine does a poor job of. So kind of refresh us, if you will, about that transition for you and when you decided to do that, just kind of that evolution of you doing what you do now.
Yeah, so I spent almost 25 years in traditional urology. I did 6 years of training in general surgery and urology, and spent every day doing, robotic surgery, vasectomies, prostate cancer treatment, all kinds of bread and butter urology stuff. And about halfway through that career, I ran into my own health issues, like so many of us do when we have a change in our career and life, where my health had declined because I had honestly neglected myself. For the sake of my career, for the sake of my patients. I was not eating well. I wasn't exercising at all at the time. I was stressed out, not sleeping, and I was a mess. When guys would come to see me and they were experiencing issues with energy, brain fog, looking for help with weight loss, sex drive, stuff like that, the only tools that we really had in our toolbox was testosterone and the blue pill. And that was it. And when those didn't work, we kind of threw our hands up in the air and said, don't really have any answer for you. And when I was that guy himself, suddenly I was very interested in finding those answers. And so I started going down rabbit holes and going through education programs, courses, certifications, and research. And next thing I know, I found this entirely new world of precision medicine, of optimization, of epigenetics, and optimizing hormones and peptides, and really putting together an integrated approach to men's health where we recognize how important things like mindset and stress are, and sleep, and how do you incorporate a fitness routine when you're so stressed out, not sleeping. How do you put all those pieces together? And so that got me very passionate about it for myself. And, how can I be the best dad that I could be? I have two beautiful kiddos now. That it changed my whole perspective. And I realized how we as traditional healthcare were failing, how I was failing as a men's health expert, as a urologist. We're great at treating cancer, treating kidney stones, treating disease, but when it comes to improving health span, when it comes to improving quality of life, we really don't have any answers in the traditional healthcare setting. And so that got me to follow my passion, and I figuratively jumped off a cliff 3 years ago, and I just left. And I left a high-paying, lucrative career. I was, at a busy group practice, doing very well and comfortable, and I gave it all up so that I can follow my passion and launch the Gapin Institute, where I now love what I do every day, and I'm making a real difference in a very different way.
Awesome. What did your colleagues say when you did that? When you told them, said, "Hey, I'm gonna go start this institute and really make people better and get away from this conventional medicine stuff"? What'd they say?
Yeah, at the time, they all thought I was batshit crazy. Why would I give it up? Why would I walk away? And now, one by one, they're all coming around like, hey, so tell me how you did. How'd you learn what you're doing? How'd you do that? And you know, you go to almost any medical doctor who's still in that health, you know, traditional allopathic healthcare model that we have, this disease model, crisis care that we have, they're miserable.
Mhm.
They're miserable. They're frustrated that they're not seeing the results they want to see. Patients are miserable. They're not getting the outcomes they want, and it's all run by the insurance companies and big pharma. And so I really have a passion for shifting the paradigm, especially when it comes to men's health. And you know, for me, it's all about how can I be the best dad I can be, and to me, that's really a passion of mine, is sharing that information and helping other men.
What do you think the biggest game changer was for you personally? Do you think it was a change in diet, exercise, testosterone? I mean, kind of all the above.
Yeah, I would all of the above, and I would say that the first thing has to be the mindset piece, because you know, think about this. It's interesting, Greg. Guys know what to do, right? We know we're supposed to exercise. We know it's the best longevity drug on the planet. We know we're supposed to sleep. We know how stress can impact our health. We know in general what we're supposed to not be eating, but guys don't do it. And I
Mm-hmm.
wasn't doing it, right? And so we could talk about all the tactics that I employed, but the first strategy, the big concept that I teach is you have to want it. You have to have that burning desire. You know, the book Napoleon Hill, Think and Grow Rich. He talks about this same concept when it comes to money, but when it comes to your health, you have to have a burning desire to fix the issues and to focus on your health as your main priority. Because if you don't have your health, you got nothing. And so for me, it was really when I decided for myself personally to have that entire perspective and you know, my focus shift, and that allowed me to really look at everything else.
Walk us through, if you will. So when a man comes to see you, and you know, I see these kind of guys too, but typical patient's going to be, you know, probably middle-aged guy, come in with probably a little overweight, fatigue. You know, some of his metabolic markers probably don't look all that good. Testosterone's probably low. Um,
Sure.
Walk us through, I guess, your approach. I mean, obviously it's going to be individualized, but new patient comes into you, you know, what kind of stuff do you like to do diagnostically, and then give us a typical patient is what you're going to recommend, what kind of labs you're going to get, and then and what you're going to do going forward.
So my Gapin protocol is really focused on having a very methodical process to help men optimize their health, whether it's, you know, I want to have more energy and focus, I want to burn fat, build muscle, I want to have better sex. And those are the three most common complaints I hear. It's energy and brain fog, it's can't build muscle, can't burn fat, or sex isn't what it used to be. One of those three categories, typically the symptoms that guys will finally seek attention. Starts with testing. You know, I say find your blind spots. You got to know your numbers. And so it starts with advanced diagnostic testing. So we will do a fairly substantial blood lab panel. That includes typically over 200 biomarkers. We're looking at, first and foremost, hormones. I think it all starts with hormones, and taking a deep dive into complex hormone markers. You know, when men think hormone, the first thing obviously is testosterone. Most men, though, are not looking at free testosterone. And most doctors out there are relying on that ridiculous reference range to the right side of the lab slip, which is very erroneous and misleading and inaccurate. And so it's understanding the nuance of that, diving deep into not just testosterone, but, you know, we have 50 hormones that we focus on. Testosterone gets all the attention, is probably the most important one, but it's DHEA and thyroid and nitric oxide and vitamin D and estrogen and melatonin and leptin and ghrelin, and it goes on and on. And so it's recognizing that there are a lot of hormones that come together, you know, call it a symphony of hormones that all have an effect. And so first, it's identifying the hormones. We're looking at markers of inflammation. We're looking at many markers of blood sugar regulation. We're looking at markers of cardiovascular risk. And it's not the typical, you know, cholesterol, LDL, HDL. Those are actually fairly worthless when it comes to cardiovascular risk assessment. So it's taking a deep dive there. Micronutrient levels. And then we look at things like the microbiome. You know, we do gut health testing with stool testing, where we can assess the integrity of the gut lining and the microbiome, which is this complex balance of good bugs and bad bugs, literally, in your gut, that actually regulates everything. It regulates energy systems, neurotransmitters, mood, hormone production. so much of what happens in your body comes from the gut. And so focusing on gut testing. From there, we'll often look at things like food sensitivity testing or organic acid testing. Food sensitivity is a blood test. Organic acid is a urine test. And these are looking at what should I be eating, or markers of metabolism that may need a correction, or is there underlying mold or other types of infections that we need to clear up. So that's all the initial testing we do. And then we focus on what can we use to individualize it. So every guy's different, right, Greg? Everyone needs different things. And so we'll then move to genetics to help us understand, based on your genetic blueprint, what should you be eating? What should you not be eating? What macronutrient ratios are right for you? You know, your genetics are a great way to understand what macro ratio is right for you. I have so many guys that have come in and they're on keto, and it's actually the wrong diet based on their genetics. And they're going to actually be able to build muscle better, burn fat better with higher complex carb intake, which is very counterintuitive. And, you know, that doesn't make any sense, but it's true. And so using genetics, we do a lot of work with wearable technology, like continuous glucose monitoring, where with a sensor on your arm, we can track 24/7 blood sugar levels and see how the food you're eating and your activity, your behavior, your lifestyle is affecting blood sugar. And I'll tell you, if you have elevated blood sugars, you have zero chance of burning fat. You have zero chance of building muscle. You're not going to reach the goals you're looking for. I'll have guys who will have a fasting blood sugar of 105, let's just say. And typically you want that under 90 or so. When you see a fasting blood sugar of 105, that means this guy's walking around with high blood sugar. He hasn't even eaten. So it's not food intake. And in those situations, it's typically stress. It's cortisol. So sometimes we may do cortisol testing, which is salivary testing, where we can look at cortisol, stress hormone levels as well. So Greg, it's putting all those pieces together that no one out there is really doing. And that's what guys need to get the results, because every guy is different. And I like to say one size fails all, and you can't have the same approach for every guy.
Yeah. So you're doing a comprehensive workup, it sounds like. I mean, not just, you know, as a urologist, you're not just looking at the penis and testosterone. I mean, you're really looking at metabolic health and cardiovascular health and really everything.
Absolutely.
So
yeah.
Okay. Well, let's dive into testosterone, if we will, if we may. There's, you know, more and more guys out there on testosterone. I mean, I do testosterone at my clinic. And so let's assume a guy comes into you, he's got low testosterone, whether, you know, low free, you know, whatever, we can talk about that a little bit. But, you know, the things I offer are either shots, daily creams, pellets. What is your approach to testosterone replacement therapy?
Yeah. So, as you mentioned, I know you have a large practice as well there. We look at, in general, three different options. There's when we're going to give testosterone replacement, it's either injectable, topical, or pellets, as you mentioned. There are two other approaches to optimizing testosterone that we should at least just mention up front here as well. Number one would be natural approaches. You know, what can I do? Guys are always asking, what can I do to naturally boost my testosterone so maybe I don't need testosterone therapy? Those are things like, you know, heavy strength training, especially working on the large belly muscles like your quads, your hams, your core, your back, stuff like that. So heavy resistance training, really optimizing and dialing in deep onto your sleep, reducing stress, lowering your cortisol levels, optimizing micronutrients, make sure you're eating enough healthy fats, getting enough B vitamins, zinc, magnesium, selenium, all those micronutrients that are important. Getting direct sunlight exposure on your scrotum has actually been shown to raise testosterone as well. Improving the gut can improve testosterone levels. So there are all these natural things, but typically that's not going to, in general, move the needle enough to where guys can be able to avoid testosterone therapy, unless his levels are great to begin with, and we're just looking to just fine tune, get him a little better. In my practice, and this goes back, you know, again, 25 years in urology, I can't say I've seen a guy coming in off the street that has testosterone levels that are where they need to be. There are probably a few in my career, but a handful out of 25 years tells you something that, you know, I call it a men's health crisis or a testosterone epidemic, where worldwide levels are almost half of what they were 20, 30 years ago. So major decline. So that's one way is to naturally try to boost it, which I don't typically find a ton of success. Now, all those things are valuable for other parts of your health, but we're not going to expect a free testosterone to go from 4 to 20, let's just say, with that sort of stuff. The second way that you can boost testosterone levels is to stimulate your body to make more. So that would mean medications, pharmaceuticals here, drugs like HCG. HCG is a medication. It's an injectable medication that's used in pregnant women to improve fertility. It's also used in men. It helps with infertility in men and also helps with boosting testosterone. And so HCG would be one option. And another drug that we can often use with that would be either clomiphene or N-clomiphene. And these are estrogen blockers, work centrally at the brain level to block the negative feedback that the brain senses from estrogen levels. And so that will increase the signal to the testicles to make more testosterone as well. So really 3 ways of boosting testosterone. We can either give it directly, exogenous testosterone, which again, there are 3 ways of doing that. You can stimulate the body to make more, or you can try natural approaches, hoping the body will kind of heal itself. And obviously every guy is different. In general, I don't find that natural approach is going to get guys where they need to be.
Yeah, same. I would agree with that. Let's talk about some of those kind of alternative drugs a little bit that guys may not know that much about, because I do some of that. And you mentioned the HCG. I was doing a lot of HCG, a lot of times in conjunction with testosterone, just to keep that testicular function, prevent shrinkage. As I'm sure you probably know, or at least here, the HCG recently went up in price.
Yes.
Anyway, so I've been kind of looking at some alternatives, and there's gonadorelin that's out there. I don't know if you've used any of that. And you mentioned the enclomiphene. I used to use Clomid some on some guys. I never really had a lot of luck with it, but I guess that enclomiphene is supposed to be a little bit different. So talk about those things, if you will. I mean, kind of your personal experience with patients, and have you had success with those? Maybe either as by themselves or in conjunction with testosterone replacement.
So gonadorelin, I've not had great success with it. I know some people talk about it being a great peptide. I personally don't have much good luck with that, and so I've not used that consistently for that reason.
Okay.
Clomid can cause some mood issues, some psychological cognitive stuff. And so that's when N-clomiphene is an alternative to Clomid. And so I'll sometimes switch guys over. You could titrate up, typically start 12 and a half, 25 milligrams or so of N-clomiphene, and you can go up to 25 to even as high as 50 milligrams of that. Clomiphene, I've gone up to as high as 50 to even 100 milligrams as probably a max dose. And if you don't get results with that, I don't know that I would recommend going much higher than that. But yeah, those are the 2 estrogen blockers that I'll find that the combination of Clomid or N-clomiphene plus HCG tends to be a good combination. It works pretty well. Yeah.
Okay. So do you do a lot of those in conjunction with testosterone therapy?
I don't. Yeah, I know a lot of guys talk about that. I personally don't. Now, when you're giving testosterone, the question is, well, why would you tell your body to make testosterone if you're giving it? Because when you're giving exogenous testosterone, you are in essence turning off, through negative feedback to the brain. You're telling the brain the body's got enough. I don't need any more, and so it's going to turn off production. When you're giving HCG, you're trying to stimulate the testicles to produce more testosterone, which to me doesn't make any sense, and it's not needed. The one situation I will use HCG is going to be if a guy is concerned about or already has testicular atrophy. And that doesn't happen very often, but some guys will get, and I'd say, under 5% of guys will notice some atrophy, shrinking of their testicles when they're on testosterone. And so I like HCG in that situation to help just support testicular, viability, if you will. But I don't ever really give Clomid in that situation, Greg, because I'm not trying to stimulate the body's production of testosterone, because we've already decided that we're giving testosterone. And so I don't typically use those together.
Yeah, gotcha. Okay. Well, let's talk about a big issue, ED, or erectile dysfunction. I see a lot of men as well, and that just seems to be a growing concern with men, and more and more. I'm seeing that more and more, even guys on testosterone, coming in and obviously as they get older, I mean, that's just something that can happen. And so, especially as a urologist, and now that you're in integrative medicine, I guess talk about that, what your approach is to that, and maybe what some guys can do that are suffering with that.
Yeah. So when guys are struggling with ED, it first so important to really understand the context of it and get a good history and really take the time to understand the nuance of it. I'll give you an example. I've had guys who, and this is very common in this day and age, who have issues with porn. And porn addiction is a real problem in the society where guys use porn. And what happens with porn, guys look at porn, they're masturbating, and what it does is it increases dopamine levels in the brain. That's the pleasure neurotransmitter, the pleasure hormone that with porn, you're increasing dopamine levels. Eventually what happens is you lose sensitivity to those dopamine receptors and you need more and more and more. And eventually this is actually what leads guys to have sexual deviancy and go cheat and go down a dark pathway there. But the point is that guy who's having issues with ED with his partner is purely based on porn addiction and the dopamine centers in the brain that are getting disrupted. And real life can never live up to porn, right? It can never match, reality can never match that fantasy world. And so I've seen a lot of men struggle with that. So that's one situation. Other guys have situations where they're not using porn at all and they're fine by themselves, but they have performance anxiety with their partner. Well, this is where we have to look at, well, what's going on? Is there stress involved? Is there other factors that may be affecting it? And then you look at, is it hormone driven? And a lot of guys have obviously testosterone, thyroid, DHEA can be a big part of it. Estrogen can be a big part of it. And so it's understanding all these factors that come into play. There are so many clinics out there, Greg, that are advertising, just come on in, you have ED, get Gaines Wave, and you'll be all set. Just run your credit card and you're all set. I think that there are Band-Aid short-term solutions for ED, and there are long-term solutions for ED. Band-Aid solutions are things like, the blue pill, the yellow pill, Viagra, Cialis, a vacuum erection device, injection therapy. We have a lot of guys who will do like trimix or quad mix injections to stimulate a short-term erection just to be able to perform. But then there's the long-term solutions. How do we fix the underlying problem? And Gaines Wave may be one of those options, but oftentimes it's fixing hormones, reducing systemic inflammation, controlling cortisol levels, your stress hormone, regulating blood sugar levels, actually clean up the gut. When you fix all these things, when you fix a guy's sleep quality, when you get him eating well, help him lose weight, burn fat specifically, getting him on a fitness routine. It's crazy, Greg, how all of these things matter and they all add up. And guys will say, well, how does what I eat have to do with my erection? And my answer is it has everything to do with your erection because it's all connected. It's all integrated. That's, hence the term integrated medicine. And so that, in summary, that there's not one single magic bullet that's going to fix ED. It's understanding the nuance and the cause of it, and then really addressing those causes, and not take the one size fails all. Here's your Viagra, and send them on their way.
Gotcha. Let me circle back if I may, because you mentioned some other hormones that we didn't talk about much, but one of those is DHEA. And obviously that's a over-the-counter, supplement you can buy. And talk about, I guess, DHEA, because that's honestly that's not something I stress a lot in guys. To take. Sometimes I check levels, especially if they're not responding, but it's not something I check initially. Talk about that, if you will, and maybe even DHT, how much you look at that, and then just some of those kind of little minor sex hormones and how much you pay attention to those, and then maybe what you recommend supplementation wise. And specifically for the DHEA, do you recommend kind of higher levels of normal like we would do in typical, TRT therapy, or what's your approach to that?
I love DHEA. I think it's great when it comes to mood, when it comes to energy and metabolism. It is, if you think of the steroid pathway, you start with cholesterol as your precursor, it goes to pregnenolone, and then gets converted into DHEA, which ultimately is the precursor to testosterone. And so the cholesterol, synthesis pathway to testosterone goes through DHEA. And so what I'll often find is when guys have low testosterone levels, they almost uniformly will have low DHEA sulfate levels as well. So when I check labs, it's specifically DHEA sulfate, and sulfate is, DHEA-S. And the reason for that is that sulfation is what makes it active. And so we'll talk about supplementation in a second, but the DHEA has to get activated or sulfated, and that relies on healthy gut for that to occur properly. Then it's in the active form. And so I do test levels on DHEA sulfate. I aim for a target for between 300 and 600, which is definitely on the high end of that range. But for men, my goal there is 300 to 600. And I find that when we give testosterone therapy, exogenous testosterone, DHEA levels will plummet as well. And it makes sense if you think about that pathway, you're turning it off because you're giving testosterone so the body knows that it doesn't need to make any more. And so you're not making any DHEA either in that pathway toward testosterone. And so most guys who are given testosterone, I'll find that their DHEA levels will actually drop at that first check. So when it comes to supplementation, typically they come in 25 milligram capsules. You can use 25 milligrams a day. You can do 25 milligrams twice a day. It really depends on levels and dosing. There's a lot of really poor quality DHEA out there. You can actually get it compounded. You can get it micronized, which is, I trained through Neil Rouzier out at WorldLink, and he talks about compounded DHEA, which is certainly much more expensive, but it gives you a consistent high level throughout the day, rather than when you take oral, you get a very short peak and then it kind of comes back down again. So you have to take it, consistently. So I do like DHEA supplementation for men.
Okay. Okay.
Yeah.
Very nice. So talk about, if you will, I can't remember if I asked you this the first time you were on or not, but talk about your daily regimen, because I think that would give guys listening kind of a good understanding of just, and if there's any regular listeners, I mean, they probably have heard this, but it'll just give them good understanding of what they should do, because there's probably a lot of overlap of what you do that what most guys should do. So talk about maybe what you eat, your exercise program, I mean, that kind of stuff.
So I eat nearly completely gluten-free. I will eat very occasionally, very rarely. I'm going to have a birthday, a piece of birthday cake. I'm not going to be that, regimented that I can't occasionally live and enjoy life. But in general, I don't eat much gluten at all. And when I do now, I just don't enjoy it. You feel like crap afterwards. So don't eat a lot of gluten. I heavily focus on protein, and I think in general, guys don't eat enough protein. And so I aim for 1 gram of protein intake per day per pound of body weight. So I weigh about 165. And so that means about 165 grams of protein a day. And that's tough if you're not trying. You have to really work at it. And if you will track your intake for a couple of days, you'll find that you're not even anywhere close unless you're really making a good effort. So the rule of thumb is anywhere from 0.8 to 1. I aim for 1, knowing that you're not going to quite reach there, gram of protein per pound of body weight. And if I'm fasting, if it's a day, and typically about 2 to 3 days a week, I'll do intermittent fasting, and so that will be at least an 18-hour fast, where I will I'll go from 6 p.m., which is when I'll finish dinner with my family or so, until noon the next day. And that 18-hour window will be my fasting window. And then my feeding window, I have 6 hours to get that protein in. You got to really work hard on those days to get the protein in. So my diet is clean. I eat very little sugar, a lot of protein, a lot of, I focus on, I eat meat. I very much enjoy meat. So I like animal protein. I eat fruits and vegetables. I make protein smoothies. I eat, whey protein, organic whey protein is my powder of choice. And that's what I eat on a regular basis. It's the fresh, natural stuff where there's very few packages where you don't understand any of the ingredients. I really tend to steer people away from products that have one ingredient in them. So that's what I eat. I am obsessed with focusing on good quality sleep. And when I don't get good quality sleep, I see how much it disrupts my focus, my energy, my productivity. And so I try to really emphasize quality sleep. And when I say quality, that means really tracking it with a wearable where you can see your deep sleep and your REM sleep. Rule of thumb there is you want 2 hours of REM sleep and you want at least 1 hour of deep sleep every night. The light sleep, you don't tend to get nearly as much benefit from that. And so those metrics are really important. And so that's the matter of, turning off the blue light 3 hours before bed, focusing on, turning your mind down during those last few hours, and being really, really committed to what's my bedtime and making sure you're going to bed then and not staying up too late, sort of thing. When it comes to training, I will work out with a trainer several days a week. I'll work out on my own several days a week. And I do that just to provide added accountability. Could I do it all on my own? Yes. I don't necessarily need a trainer. It's more now become, he's a friend of mine, but I also enjoy the camaraderie. He pushes me probably harder than I might push myself as well. So I also recommend for guys out there who maybe don't train a lot and who are trying to get into it, to spend the money on working out with a trainer in the beginning just to get proper technique down. I've seen so many men who get all gung-ho, especially, next month, January comes around, all these guys are going to start hitting the gym again when they haven't touched a weight in a year, and they get injured. And then they're screwed for months because they've injured themselves and they can't do the work that they need to do. And so spend the extra time on to get a trainer, at least until you're comfortable that your technique is good. I believe resistance training is key. I believe that as you get older, most guys neglect the resistance training, the heavy weights that we need to, muscle is critical for longevity, along with the protein intake to help build the muscle. So I'm more focused on resistance training with some cardio and aerobic training combined in there as well. And then some low intensity, take a day and just go for a walk, do some yoga, do some, stretching, do some low intensity stuff as well. So, you need that up and down. You need the balance of rest and recovery as well as pushing yourself. And some guys will overdo it. They'll train hard every single day, and your body needs that rest. I emphasize that you don't build muscle when you're training, right?
Mm-hmm.
You don't build any muscle when you're training. You're actually tearing it down. You're building muscle when you're sleeping the next night, and so on, the times that you're repairing, rebuilding, recovering your body. And so I really emphasize that balance there. What else?
Yeah, that's good stuff. I mean, gosh, it's very similar to what I do. I love the 1 gram of protein per pound of body weight. I agree with you. I don't think people get enough. Resistance training. I mean, that's just no, that's great advice. Have you mentioned kind of sleep routine, sleep hygiene, that kind of thing. Any other sleep hacks? Have you played around much with like super high doses of melatonin? I know there's a kind of a small camp of people who advocate for that. Any experience with that? Or
interesting you say that. I don't recommend melatonin myself personally. What I have found, and this was going back, so in my urology career, I spent several years running a precision medicine program while I was still in practice. And so when I left 3 years ago, I already had some experience doing it. So, 4 or 5 years ago now, I was doing just that. I was prescribing melatonin. If a guy wasn't sleeping, I'm going to give you more melatonin and more. And I had guys up to like 8, 12, 15 milligrams of melatonin, like ridiculous amounts of melatonin. But what I've learned is that your body doesn't need much more than like half a milligram to 1 milligram of melatonin. And so what I find when guys are struggling with sleep is it's not the melatonin, and what's going to fix it is not the melatonin. And so, first of all, it's the sleep hygiene, the hacks. What are you doing in the evening? And most guys, it comes down to they're still on the laptop. It's 12:31 in the morning. They're still on the laptop working. Mm-hmm. You're not going to get quality sleep when you're doing that, no matter how hard you try. And so it's first of all, what time you got to be up? If it's 6, okay, that means 7.5 hours from that 10:30, you got to be in bed going to sleep, like no exceptions. And so it's working backwards and scheduling that into your day. And so for that last 3 hours before bed, there's no more laptops, computers, blue light. For the last hour before you go to bed, and there's no food or water intake other than if you're taking your supplements or pills, for example. I would really limit any food or water. That last hour, I like to joke that there are 5 things you can do. You can read, you can meditate, you can journal, you can do sauna, which is amazing for sleep, or you can have sex. And I say you shouldn't do them all at the same time. That'd be super odd and awkward. But any of those 5 are good options for that last hour to kind of get your mind turned off in the in the state of preparing for sleep. And so that's going to help a lot. Now, when it comes to supplementation, I again have not found good success with high doses of melatonin. I've heard some guys out there talking about it. I don't recommend it. I use supplements like 5-HTP,
Mhm.
GABA. GABA is a great calming, inhibitory neurotransmitter. Pregabalin is the pharmaceutical version of that, but GABA supplementation is great. L-theanine. L-theanine is a great one. Ashwagandha for some people can be effective. I've used peptide DHHB as a mood regulator that may help with sleep as well. There's some other peptides, C-Link, C-Max, DSIP, which can be helpful for sleep. So those are the main ones. Yeah, and I've actually used some compounded agents that will have trazodone in it as a last resort as well. It's a pharmaceutical that's been around forever, but it's a clean drug that does not have any major side effects and doesn't have a residual grogginess the next morning either.
Well, what else? Anything that I didn't ask that you want to throw out there? Just
Yeah,
general
I think
men's health
probably,
topics, or?
yeah, let's touch briefly on peptides. I think it's a hot
Oh, yeah,
topic
yeah.
right now.
Okay,
And
yeah.
yeah, so peptides are amazing. We've been using peptides for several years, and they're a great addition to everything else we do. The FDA hates them,
Mm-hmm.
right? The FDA hates them because they're not big pharma. They're not a pharmaceutical. They're simply short proteins. They're chains of amino acids, a specific sequence of amino acid that will work as a signaling molecule for very precise function. Because of that, that means you can't patent them. That means that big pharma can't make a shit load of money on them. And so they'll always be in that essence generic. And so the challenge there is you'll never have a 10-year randomized placebo-controlled trial like you will big pharma. You'll never have, clinical, phase 1, 2, and 3 trials for them. And so they're never going to reach that, the hurdle, overcome the hurdle to prove, the traditional big pharma way of proving a drug or peptide in this case is safe and effective. But we have tons of scientific data that shows that it is. So because of this, late September, FDA came out and categorized many of the peptides that we use as category 2. And what that means is they cannot determine the safety of these peptides. My one-word response is bullshit. And we have tons of data, tons of scientific evidence that they are safe, they are effective, they've been around for a long time. But nonetheless, a lot of peptides are going away because compounding pharmacies now are nervous about producing them because they could come under scrutiny. They could come at the FDA could come after them for that reason. And so we're losing a bunch of peptides. There are a lot of others that we could use instead that are okay, that are not under category 2 from the FDA. But it's a constant battle. Greg, we're trying to get our patients, I know you're doing the same in your practice, to get the best outcomes for our patients with whatever tools that we have that we know are safe and effective. And it's a battle to sometimes get the stuff that we need.
Yeah. So what are some of your favorites that you're still using now just to optimize health in men?
So BPC is one that a lot of people know about. I'll start with the familiar ones first. So BPC is a great peptide for reducing inflammation. The injectable is now a category 2, so it is going to be one of those that's going to disappear. The oral one is not, though, and the oral, especially combined with another peptide called KPV, is going to be still available as a nutraceutical. And by that classification, that means that we can still use it. It's great for inflammation, especially in the gut. I've seen so many guys that have major gut issues, microbiome problems that are dramatically improved with oral BPC. I've even seen it have some musculoskeletal benefit, which is not supposed to, but I've seen it as well. So BPC is great. The growth hormone peptides are a lot of them are going away. So people are familiar with CJC ipamorelin combination of a way to boost your body's natural, if you will, production of growth hormone. Those are going away. CJC and ipamorelin are both category 2 now. However, we still have tesamorelin. And tesamorelin is actually a better peptide than CJC ipamorelin, and it's been around forever. It's used in HIV patients a decade ago, and it's still available. That one is much more potent than CJC. And for that reason, we only use it maybe once every 4 months or so. We'll cycle it on and off. So I like tesamorelin. when it comes to musculoskeletal repair, thymosin beta has been a great peptide that I've used a lot in the past. That one's going to be going away as well. There are other peptides that we can use, like pentosan polysulfate. That's another good one that is going to still be around that we can use for inflammation, musculoskeletal repair, stuff like that. What else? C-Link, C-Max are great peptides that we've used for mood issues, for stress, for anxiety. Oxytocin is another hormone peptide that is a replacement that's been around for a long time and actually can help with stress. There are peptides that are great for cardiovascular health. So citronol is a great one that has been shown to lower LDL.
So you didn't mention PT-141. Do you use some of that, especially as a urologist?
PT-141, that's the fun one. That's the one that's going to improve sexual arousal, and it's great for improving sexual performance. Mm-hmm. I've not seen great results with it for guys with actual ED. I've seen it great at improving sexual performance in guys who just want to make it better, kind of thing. Mm-hmm. But I don't tend to find great results with guys with full on problems, ED issues. It's actually good for women as well. PT-141 is great for arousal in women. So I've had several couples who will get it for both of them to take while they're going away on
like a weekend getaway. Yeah.
Yeah, right.
Yeah, I haven't used it much in women. Definitely I've had some guys, take it and like it, but it does come with some nausea and flushing and stuff for a little while. So
I had one couple actually who did just that, took it with them on a weekend, and the wife took probably more than she should have, I guess, or just had an untoward reaction, and she was throwing up the whole weekend. And
wow,
not having sex in that situation.
Oh man, yeah. Well, very good. Well, okay. So to get a hold of you, you are at drtracygapin.com, and I'll put that in the show notes. And I guess that's probably the best place people can see what all you're doing, reach out to you, that kind of thing.
Yeah, that's actually my professional site. My institute is gapininstitute.com, and that's the center. Okay. You can see all of our services there. And I'll also share with the listener, I have a gift. I have a high performance health handbook, which is 15 strategies and tactics that you can use starting today to have more energy, lose weight, and have better sex, which again are really the three things most guys are looking for, right? And so just text the word health. That's HEALTH, health. Text the word health to 26786. So that's 26786. Text the word health, and you'll get a free copy of that. I'm also going to give anyone who opts into that a free copy of my book, Male 2.0, Cracking the Code to Limitless Health and Vitality as well.
Very nice. Okay. Appreciate that. Well, as we wrap up here, I always ask my guests if they could give us one health tip that would make us healthier today. What would you say to that?
Live with intention. So many guys know what to do, but they just don't do it. And they're not focused. They're not passionate about what's important to them. What's your why? For me, it's my kids. And what do I got to do to fulfill that why? And is everything I'm doing in alignment with that? If I'm drinking 3 drinks a night, it's not in alignment with that. And so just making those little baby steps, those little changes every day is going to add up and make a difference. But it starts with a burning desire to achieve that goal.
All right. Well, Dr. Tracy Gapin, a lot of information in a short amount of time, but appreciate you coming back on the show. And appreciate everyone listening. And we will talk to you next time. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like, you can check out our website at vibrantlifedc.com, or you can email me at drgreg@vibrantlifedc.com.